The imaging space in today's environment is just getting more and more complex as it relates to the number of things that we do, and so the pressures have grown tremendously.
There are a lot of pressures on the department as well as myself regarding certain imaging parameters, and that's why we track the metric turnaround times, especially for trauma patients and for strokes.
With stroke victims, every minute matters. If that patient has a bleed or if that patient has a massive clot, we need to do it quickly. We need to get the images quickly and get them off to the radiologist. It really makes a difference, just a few minutes being more efficient.
My first exposure to PerformanceBridge Practice was through our partnership with Philips, and it was one of the tools that they made us aware of and one of the opportunities. And as they did some initial assessments, we began to get a sense for how powerful that tool and that practice would be for us.
What PerformanceBridge offers is one-stop shop where we can access all the data that we need, which is previously in various locations, very siloed, and we have various data systems. Now that's all synthesized into one place.
PerformanceBridge is fundamentally about operations and operational improvement. In order to drive those operational improvements, you need to understand where you are today. So assessments really look at what is the baseline in your various areas. And we then bring benchmarks from our own experiences through third-party data to then benchmark the practice. And then we can combine those assessments with the PerformanceBridge analytics and workflow tools to actually drive those improvements in, to codify them, to digitize them, and make them part of the workflow.
Every element of delay, every element of waste is impactful. And usually that waste, probably the vast majority of the time, influences costs. So if we really are truly after patient-centered care, we start there, we fix that, and finances will take care of itself.
What the PerformanceBridge will allow us to do is to analyze every phase of the imaging chain so that we can become maximally efficient.
Working with Philips in this space has been really pretty amazing, and it's been fun to begin to understand the changes that Philips have made from a traditional, making CTs, ultrasound, to a full solution delivery organization.
The PerformanceBridge solution has really allowed us to unlock value around our triple lane. So we can identify now where are our areas of opportunity, how we can improve efficiency, and efficiency adds up to dollars. And we can take those gains and feed them back into our mission of making healthcare easier for our customers.